So we're starting a jaw surgery for this patient. You can see how this part is inside. So he's an adult guy. We're still using a distraction technique to get new bone, to get the upper jaw forward. And you can see from here, he's had multiple earlier surgeries in different other Indian cities. He's come to us for the first time. This is the first revision procedure that I'm planning. You can see how the lip is attached onto the prolabium and it's moving when I move it. So not only will I have to get the upper jaw forward, but I have to try and get the lip muscles in the right place. That small prolabium, rudimentary one, is actually riding in front of the two clefts posteriorly. Langenberg. Here's the sides. Okay. சின்ன பர் போடுங்க என்னது
Okay.
Good. Slowly now. Okay. So you can see the osteotomy here. I'm going to show you the cut. And that's the distractor. I've left this piece of, it's actually a tissue that's making the nasal floor intact. Because the patient also has a fistula that I'm going to close. That's the rudimentary prolabium that's shaking. Rudimentary premaxilla that's shaking, I'm sorry. And this is the attachment of the septum with the ANS, which I've detached. I've left the soft tissue there for vascularity. And I've gone, made the cut, very, very thick maxilla. What you see here is a sinus. What you see up here is the infraorbital nerve. And we're going to turn you can relax another bit and show you how the maxilla is going to come forward with the turning of the screw. So you see this is a 13 millimeter screw that we've got. So once I turn this screw, the maxilla will come up forward from this place up, and that's going to get new bone deposition there. So there you see a lot of work has been done at the base of the lip. I showed you how his lip was before we started. It was attached to the prolabium. The prolabium was moving while I was moving the lip. Now it's not so. The lip is separate, the prolabium is separate. Got a nice sulcus depth. I'm closing up now. Give me a retractor. I want to put the retractor on the other side to start with, on this side. Okay, so you can see the... No, it's okay. Sorry. And just turn. So you have to do this, yeah.
In Karnataka, theatres have opened.
Oh.
Movie theatres.
This. So you can see this is a continuous kind of suturing I'm giving. So we will go all the way up to the premaxilla, and by doing this you'll see I've closed a fistula. So not only have we done a jaw surgery for this patient, not only have we done muscle anastomosis for the patient at the base of the lip, at the same time I've also closed a fistula that he had between the alveolus and the lips. So it's like a 3-in-1 procedure. A lot of the revision, a lot of the secondary procedures, especially cleft related, are like this, where I combine 2 or 3 surgeries in one go. So the benefit for the patient is the maximum. If you see, before we started, he had a hole there. There's no hole now. And I want to close this side also in such a way that it doesn't have any residual deformity. So there we are. We've just completed another jaw surgery for this patient. So we've got the upper jaw forward by ways of distraction. I've done a lip revision, also kind of fistula closures on both the sides of the alveolus, all in one go. As I was mentioning earlier, a lot of these revision procedures who come to us, I tend to do multiple procedures for them in one go to try and get them back to as much normalcy as possible. He would further need rhinoplasty and speech surgery in the coming weeks and months.